Hi, and welcome to the 5-Minute Check-In. So today we're going to do a brief update on allergies, both some new therapies and some new delivery systems. And to join us in this conversation today is my favorite allergy immunologist expert, Dr. Rajan Merchant. Rajan, thanks for joining.
Hi, Dr. McGinn. Thank you for having me.
Great. Well, we've got a lot of territory to cover. We have three subjects we're going to talk about today. So let's start with the first, which I find fascinating, that we may have an alternative to the good old EpiPen in the injectable epinephrine for patients undergoing anaphylaxis. So, do you want to tell us a little bit about that?
So yeah, there's a new delivery device that was approved by the FDA for nasal delivery of epinephrine called Neffy. Basically, will treat an anaphylactic reaction that patients experience with a single delivery into the nasal, passage with symptom resolution within 1 to 5 minutes of, medication being administered.
And easy to carry? Is it easy for people to use? And is this theoretical, or are people actually out there using it right now?
Yeah, no, so it's easy to carry, very convenient. I think the most advantageous compared to, traditional delivery is that most individuals are sort of afraid of needles, and so having an auto-injector, although it's been around forever and simple to use, a lot of people will, incorrectly use it or hesitate to use it, and so this will definitely improve the ability to administer treatment when necessary with less, fear.
Yeah, so you would imagine some folks undergoing anaphylaxis are like, well, should I take the injection? It's going to hurt. This could be, well, I should do it, which is the way we want them to behave. So that's exciting. All right, let's move on to food allergies and omalizumab, which is one of my more difficult things to say, which is the brand name is Xolair, is being used now in food allergy space. You want to tell us a little bit about that?
Yeah, so omalizumab has been treatment for asthma and now has been approved for food allergy to reduce anaphylaxis risk in individuals with multiple food allergies.
Hmm. And who are eligible for the omalizumab?
Yeah, so treatment with omalizumab was looked at individuals as young as 1 year of age through adults with any history of multiple food allergies, common food allergens including milk, eggs, peanut, tree nuts, shellfish. All of those food categories were studied, and it reduced the risk of having significant anaphylaxis, from accidental consumption.
So is this really saying, well, maybe somebody's been having two or three anaphylactic episodes a year. We can maybe reduce it to one or maybe even zero with this. It's a monthly injection, I think it is.
Yeah, so treatment is every 2 to 4 weeks, depending on the dose. And yes, the
Hmm.
goal is to reduce anaphylaxis. Individuals who were on treatment after 4 months were able to consume a significantly higher amount of the foods that they were allergic to, which again would theoretically be able to decrease their risk of having an anaphylactic episode with accidental exposure.
Wow, interesting. Big change. And now last was a very specific treatment for peanut allergies. Can you tell us a little bit about that, a new development in that space?
Yeah, so as we get more specific treatments available, treatment for peanut allergy with oral immunotherapy is to essentially try to desensitize the body to the things that they're allergic to. And so Palforzia was approved for treatment for children, again, as young as 1 year to 17 years of age, to be able to allow them to tolerate a certain amount of peanut consumption and overall reduce that risk of anaphylaxis.
So that's all really good news to have all these new options, but I always have to ask the question of, what are the concerns about this new therapy? Are people going to maybe drop their guard a little bit, or what are your worries as you talk to patients about these new treatments and delivery system?
Yeah, so I think we still emphasize the importance that these are not cures, that we are still avoiding specific foods, but the overall goal is to reduce the risk of, again, anaphylaxis from accidental consumption, less worry about, food labeling that says, manufactured in a plant that contains, peanuts or tree nuts. Some of those things are the basic components of, again, trying to reduce anxiety, fear around eating certain foods. But generally, these treatments, again, are designed to reduce risk. And so, but we still advise about avoiding food in general.
Wow. So we have three new treatments in a sense. One is more of a delivery system, which facilitates the delivery during anaphylaxis of epinephrine, might reduce some of the barriers to people self-injecting. Second one is a general treatment for anaphylaxis or food allergies to reduce the number of allergies. And this one is a very specific treatment for peanut allergies in young children. So a lot happening here. And are you actually prescribing some of these medications with with your patients in your office?
Yeah, so we are definitely doing all three at the moment, including educating individuals about their options on epinephrine, looking at treatments, with Xolair for the right population, as well as doing oral immunotherapy for food.
Wow. So people must be very excited to have so many new opportunities to reduce their risk for anaphylaxis, et cetera.
No, yeah, I think compared to what we were historically telling everybody, just avoid, foods that they were allergic to and having to read labels carefully and, having to carry their own food. We have a lot more options and discussions now.
That's great. Well, it's such a great moment in the history of these food allergies, which I know kids suffer with, across the world. So good opportunities. Well, thanks again for joining us and for the big update. Thank you for joining me, and I'll see you at the next 5-minute check-in.